And we are also doing this live on our own KGUA YouTube stream. So, okay, all right, ma'am, don't forget your phone. You leave my lipstick alone. That was Leanne.
And you are live YouTube.
All right. Good morning, everybody. We're live on YouTube this morning, and we are reaching out all the way to Mashell. Are you in Oklahoma?
I am. I'm a
Great.
citizen of Muskogee Creek Nation, and we appreciate you having us here today.
Well, I'm always happy to meet another member of the Muskogee Creek Nation. Mashell Sourjohn is representing AARP, and many of us know AARP, AARP, and she's going to talk to us for a few minutes about the importance of enrollment in, of course, healthcare, and the fact that, and I was not surprised to learn, Mashell, we'll get into this in a moment, about the lack of health coverage by adult Native Americans. But Mashell, let's talk about you for just a moment. You are the Associate State Director of Community Outreach for the Director of Oklahoma. I say that proudly because I'm from Okmulgee, and you are working in the areas of Native American outreach, caregiving, hunger, livable communities, transportation, financial asset protection, fraud prevention, and encore entrepreneurship. That's a lot of things that you have working on. And you have a Master of Jurisprudence in Indian law. That McGirt must be of great interest to you too. So we're not going to be able to talk about McGirt today, but I'm absolutely phenomenal hearing from the Supreme Court that has everybody in Oklahoma who's not Indian reeling. And you are a certified aging in place specialist, accredited by the National Home Builders. So you have a lot going on in your background. And I noticed that you were part of the American Indian Chamber of Commerce, and I wondered if you knew Will Lowe.
Yes, absolutely. So yeah, it's the American Indian Chamber of Commerce is an amazing organization. Of course, Willow. Here in Oklahoma, we work with all of our 39 tribal nations. We do our annual AARP Oklahoma Indian Elder Honors event. And of course, with all of those incredible programs that you talked about that we do in regards to health, wealth, and self, we do work with all of our tribal nations here in Oklahoma with all of those programs and resources.
Oh, that's great. I see. Is Amanda Davis with us also? I just see her name. Okay, Amanda Davis, you look like you are muted and blocked. See if we can I unmute you, or do you have to unmute you yourself? Unmute. Your mic is okay. I think we should be seeing you any second. Everything seems to be unmuted.
I'm just here to listen in. Thank you. Michelle's going to talk.
Oh, okay. Well, thank you, Amanda Davis, also from AARP. You know, many, I don't know, gosh, at least a dozen years ago, I got to visit the AARP headquarters in Washington, D.C., and that was really interesting, and to see how AARP works right there in the main headquarters. I am an AARP member, I want you to know, and some of my healthcare coverage includes an AARP plan, I think somewhere on the prescriptions. So just so the audience knows, but this is really about our Native American community. So let's get started, Mashell, and tell us, I keep mispronouncing your name, I'm sorry, Mashell, what you do on your job, and give us some of the statistics about health coverage for Native Americans.
Certainly. So AARP's Public Policy Institute just published a new analysis that found about 20% of American Indian and Alaska Native older adults did not have health insurance in 2019. And that's more than double the rate of uninsured in the general population. So in California, where you're at, we know about 14.5% of Native Americans did not have health insurance in 2019. And we don't really know the numbers yet for 2020, but it's likely with the number of people without insurance grew in 2020 because of the pandemic. So the Affordable Care Act has really greatly reduced the number of older adults who are uninsured, but coverage has really remained unaffordable for far too many people aged 50 to 64, including many American Indian and Alaska Natives.
Now, I think a lot of people think that American Indians all have free health care and we don't need health care. Is that true? Is that a fact?
No, so the important thing to understand is that Indian Health Services is an agency within the Department of Health and Human Services, where the federal government fulfills its responsibility to healthcare to American Indians and Alaska Natives, as well as provide some fundings for tribal and urban Indian health clinics programs. And historically, Indian Health Services has been woefully underfunded to really meet our needs in Indian country, whereas health insurance helps really protect you from paying full cost of medical, emergent care, specialty care, so whenever you're sick or you're injured. But enrolling in a health coverage through the marketplace, Native Americans are going to have better access to specialty services that Indian Health Services may not provide. You can also keep getting your services through Indian Health Services or your tribal nation's healthcare services, just the same as you always do. But by enrolling in the marketplace exchange within Indian Health Services can also build your insurance program, which in turn helps Indian Health Services provide more services to other Native Americans or more service to you in the future versus spending that money, that little bit of money that's been allocated.
Well, it's very important, and I can certainly just comment on a personal level. I'm a two-time cancer survivor, and having additional healthcare coverage, obviously, with the kinds of bills that you're getting when you're in a specialized care unit. I remember one pill alone was $600 a week. That's just one pill, not counting everything else. So healthcare coverage is so expensive in our country. And it's very important, as you say, whether it's cancer, diabetes, any number of I guess those are all considered specialized healthcare needs. What are the most common needs that you see in terms of healthcare for Native people?
Well, of course, within Indian country, we have very high health disparities and across the board. And so, for Native Americans, it's really important that they do get signed up for exactly what you're just talking about, making sure that they don't have those out-of-pocket expenses for some of those that can be costly, assistance. And so for the next 2 years, there are more financial help that is available if people do purchase health insurance through the ACA marketplace, which is an online platform that offers health insurance plans for individuals, families, and even small businesses. And these new financial assistance is especially important to people our age 50 to 64 who pay more than any other age group in the marketplace for marketplace coverage and often struggle to afford their healthcare bills. People who already receive financial assistance, they are likely eligible for even more help. And if you weren't eligible for financial assistance through the marketplace before, you really should check again, because now you might be you now might be eligible.
So is there a timeline?
Yes. Sorry, thank you for asking that. On top of that, there is a special enrollment period going on for the general public through August 15th. This is going to allow more older Americans to purchase health insurance through the marketplace, but it should also be noted that while enrollment periods have been extended through August 15th for the general public, special provisions allow American Indian and Alaska Natives to purchase or change their market health insurance coverage every month. But it's important that they do that now so they can see if they are eligible for some of the new assistance that's available.
So Mashell, how do they do that? How do they find out to change their health insurance if they're not maybe through their employers, but if they're self-employed or just individuals, how do they find out about this?
Yeah, so Americans who live in the 36 state that already participate in the federal health care market exchange, they can on healthcare.gov, they automatically will be eligible for open enrollment extensions. And then there's consumers that also get coverage through their state exchanges like California, and they'll have to check with their state to see about those extended enrollment periods. Now, you can go to AARP.org/ACA to find out if you are within a federal exchange or a state exchange. And then for Californians particularly, you can visit Covered California, and that's coveredca.com.
That's a great. I see we are running out of time here already. And I really appreciate that. We're lucky enough to have an insurance broker in our town that helps us, at least tries to help us understand our healthcare coverage. It's so complicated. It's ridiculously complicated, but it's so important. And Mashell, how do people reach you if they could get more help? AARP is wonderful. I don't know if they just reach out, as you say, through AARP at AARPACC.org. Is that it?
Yes,
And here in California, under Covered California. But it really helps if you have someone who can talk you through this stuff.
absolutely. We do have some great resources at AARP.org/ACA. For people who want to purchase health insurance or see what subsidies that they qualify for, they can visit healthcare.gov. And then again, in California, they can visit coveredca.com. And those are issue experts that will help them determine what kind of benefits and additional resources that they'd be eligible for.
Well, is there any last thing that we need to talk about before we go?
Yeah, I also just wanted to mention, you asked how people can reach out to me. We do have one of me in every one of our states. So we have local offices and so they can reach out to their local AARP office. But of course, I'm always available, love to connect people with the resources that we have at AARP. And again, talk about some of our great programming that we have. So we appreciate you so much. Thanks for the opportunity for being here today. And we appreciate you, Mado.
Well, I'm going to have to reach out to you again, and we can do a longer interview about Indians and healthcare coverage. I think it's very important. Of course, here we have to the south of me at the radio station, the Kashaya-Pomo to the south, and to the north, the Bokea tribe in Manchester. And we can talk about Native healthcare. And I think that would be very good to do. And Amanda Davis, thank you for listening in. I'm sorry, we have to run. We've got another interview waiting in the wings. So nice to meet you, Mashell Sourjohn, who is a proud member of my nation, the Muskogee Nation, and also is Cherokee. So thank you guys so much. We will be in touch, and this was live on YouTube. We'll give you a link to that, and we will be also posting this interview on our radio station very soon. Thank you so very much.
Thank you.